So what's up, class of 2018? So some of the advice that I have for you guys is that make sure you show up on time, either 5 or 10 minutes early, whatever the case may be. Make sure you dress appropriately for the setting that you're in. Um, Make sure that you park far because you're not a patient or a client that's getting services from the facility itself. You're there to provide services, so make sure you park far. Um, it's okay to be nervous on your first rotation or every rotation that you go to, but you also want to show confidence. So if on the first day your CI says, okay, you're going to do this evaluation, don't be hesitant and say, no, just go in there and perform it to your best of your ability, because you know your basics. Make sure you take a good subjective history of what the patient's there for, their current diagnosis, when was their onset, et cetera, et cetera. Make sure you know your basics of range of motion, manual muscle testing, your reflexes, your sensation, the myotomes, dermatomes, all that good stuff. Then, as far as special testing, make sure you pick the ones that are best for you, or that you think that's most reliable or has the best validity to it, um, and not perform every special test that's in the book for a specific joint. So make sure you pick and choose your special test, and stick to them. And of course, your CIs is gonna probably have their preference of what they use. So be be aware of that, or you might use their special test that they use. As far as modalities, make sure you know the settings and how to use them, or the recommended settings for specific things, and the contraindications and precautions. Then also for those who are going into inpatient, um, you're going to be inpatient or sniff. You're going to be mainly doing transfers and balance training and gait training. So make sure you know all your assistive devices, how to use them, how to assemble them. Make sure you know the Berg, the dynamic gait index. There's the tug. There's all those other tests. You don't know them. You don't have to know them by heart, but just make sure you know how to implement them and how to score them. So those are the advice that I would give you. I hope to see you guys before graduation, but if not, good luck to y'all, and I know y'all are going to do awesome.